This is called the doorway stretch, and what you'll have the patient do is bring both arms up to their sides and just kind of lean forward with one foot in front of the other and just hold it for 10 seconds 10 times. And if it's hard for them to have their arms up this high, they can kind of lower them down to their sides a little bit. And they can also do this in a corner, just stretching their arms back, really stretching through their pecs. On the chart, if it says arms low, they can just have their palms down like this, still stretching through the upper chest. All right, this is the foam roller, and there are a few different ways that we can use this to stretch our back. The first way is we'll just lay it down like this and have the patient lay down with the foam roller along their spine. And they'll just kind of lay in this position, letting it stretch out their back for a minute. Another direction is laying it this way with the patient laying on it. And this will also stretch out the back. And then another way is having them lay on it again like this, and then just having their arms in different positions. Usually if there's different arm positions while they're laying on the foam roller, it will be out to the side and up above their head like this. There are a lot of different ways that the therapist will have the patient do this, and each therapist kind of has their own way that they like to do it. So if there's any questions, you can just ask your therapist for clarification. All right, this is the lacrosse ball, and we'll often have patients use it to kind of roll out knots or trigger points in their neck or back. So what they'll do is they'll put it behind their neck on the wall and just kind of find a spot where there's a knot or a trigger point, and they'll hold it there for about 1 to 2 minutes, and then they can go to another area and do it for 1 to 2 minutes. And again, they can do it kind of lower in their back as well. When you do this while it's behind you on your back, if you bring your feet out away from the wall, it just adds more pressure onto that knot.
Okay, this is going to be your cervical AROM. There are 6 different directions that we'll do. So we'll have them start with flexion and extension. So flexion is chin down, extension is chin up. And then you'll do 3 sets of 15 with a 3-second hold in each direction. They'll also do side bending, this 3 times 15, and then rotating to either side. Okay, so this exercise is called a wall slide. It's a little different than the wall slides that you've learned before. So you'll have them come up and place both arms on the wall with their hand to elbow connected. And they're gonna slide both arms up at the same time, focusing on keeping them even and coordinated until they feel a good stretch. And come back down. And they can also do that with a band, a clamshell band. So they'll slip that over kind of the middle of their arm. And again, focusing on keeping that outward tension, and slide up at the same time and slide back down. If you place the band around their hands and have them pull into a slight external rotation, this can be used as a strengthening exercise, and still have them slide up with both arms, slide back down, keeping that tension outward. This exercise is a cervical extension while being prone. So you'll have them lay on their stomach, usually on the edge of a table, and just have them extend their head and come back down to a neutral position and then back up. I'm gonna do 3 sets of 15 of that. And if the patient feels uncomfortable letting their head drop all the way down, remind them that just come to a neutral position and just extend from there.
And then just having their arms in different positions for the time period.